All right, what do you do when your kid tells you their wisdom teeth need to come out? First and foremost, you should go to the dentist and have them actually take an x-ray, panoramic x-ray at the minimum. But a lot of times when that teenager is coming in complaining to the parent, hey, my face is swollen or I'm having pain. Yeah, we don't think about a teenager teething, but it's painful. It's not fun. I mean, your 6-year-old child, your 6-month-old child didn't like it. What makes you think your 16-year-old child's gonna like it? It sucks. Nobody likes their tooth growing in, but it's a part of life and it's not the end of the world. We just need to make sure it's coming in properly, coming in straight, and the soft tissue is not infected. How do you ask the dentist to clarify the rationale to take out that tooth? Ask them, is this medically and dentally necessary? Or are we just doing this because we just do it? It's been done on my other kids, it's been done on me, so therefore we need to do it on my current child right here. It's not necessary a lot of times. And dentists, just like they were taught in dental school, and we're all taught this way, you know, orthodontists and oral surgeons and general dentists. Now each profession, each specialty has their own justification, right? Orthodontists, even though it may not be actually accurate, they say that when a wisdom tooth comes in, you may get crowding in the front. That has been debunked. Your wisdom tooth are pretty far back there, right? By the time the forces translate to the front teeth, you're probably not getting crowding from that. Nevertheless, people still recommend extractions or for orthodontic purposes, for that crowding purpose. Oral surgeons, they recommend taking out wisdom teeth when kids are young because the roots aren't fully developed, right? And kids heal so much faster than adults. So taking that tooth out early is significantly easier for them, and the child has an easier time recovering. And then general dentists recommend taking it out because they don't need to deal with it. They can punt it either to the oral surgeon, or if it's easy enough, they'll do it. Then they don't have to worry about filling it. They don't got to worry about talking about brushing it with the hygienist and flossing around it. Just to get rid of it, we don't have to deal with the problem. So each specialty has their own reasoning, even though we want to keep that wisdom tooth for life. So once again, make sure that your doctor, your dentist, is recommending it because it really needs to come out, not just because we were taught or indoctrinated to take them out. Wisdom teeth are a blessing. It's like an organ. It's like a part of your body. Wisdom teeth maintain bone structure, facial profile, balance. As we age, and sometimes we do need teeth to be taken out, you get more of a sunken face appearance, right? That's kind of like an older look. So it maintains facial profile, bone stability. And then for airway, it still maintains a better airway too. Now, there are some literature out there that talks about the pharyngeal wall muscles and keeping it taut. And so we definitely want to keep the wisdom teeth to keep the airway nice and strong and wide. So what we're going to look at is the tooth coming in straight? The wisdom tooth coming in straight, then more likely than not we can save it and not take it out. If it's coming in impacted or crooked or horizontal, then maybe that could be a reason to take it out. A teenager is coming in complaining to the parent, hey, my face is swollen, or, you know, I'm having pain. A lot of times that's an infection of the soft tissue. So what that means is, just like when your child was erupting teeth when they were 6, or their 12-year-old molar, it pops through the gum. The wisdom tooth gum is the same exact kind of concept. The tooth is still coming out. So while that gum is still floppy on the tissue, food gets stuck. All right? That is a soft tissue infection, right? And so, yes, majority of dentists will still recommend taking that wisdom tooth out. But in my office, what Dr. Newaz and I look at is it really a tooth problem, or is it actually a gum problem? Because like I said before, we don't necessarily want to take out a healthy, straight wisdom tooth that has enough space. So in that circumstance, what we do is we do something called an operculectomy. Operculum is a tissue that's flopping around on the wisdom tooth. So what we do is we take a little laser, we get your child numb, get the patient numb. We take a little laser and we cut where that floppy tissue is. We give a mouth a rinse that we give a little syringe, and then the patient can go home and clean that area out with an antimicrobial rinse. And yeah, sometimes we'll also give an antibiotic, right, to clean up that infection. We give it a couple of weeks, see how your child is doing. More often than not, because we saved that tooth for a reason. We saved it because there was space. We saved that tooth because it's coming in straight. That problem usually resolves itself, and now your child still has an extra set of teeth. Versus, oh, I had some pain, mom and dad, and the dentist, you go to the dentist, oh, well, that tooth needs to come out. Well, it really may not need to come out. Now, most dentists don't really do operculectomies because they don't really know about it, they don't think about it, but it's an option. So can we save that tooth by removing the tissue that's causing the problem?